Thank you all for joining us today, both live and for those who are going to watch the recording of our session later. It's our weekly Center for Healthcare Policy and Research seminar series. I direct our center, and we have a few groups of people joining us today, Dr. Nguyen. We have staff and faculty in our center. We have students who are enrolled in a public health seminar that they take for a seminar credit in our Department of Public Health Sciences. So some of them are joining us. And then we also offer some continuing medical education for some physicians and clinicians who want to pop into some of our centers. And we have other people who just love the topics and then just come and attend. So we have a few different audiences with us today, and we have been rotating on topics that are more policy focused, more research focused, and more community engagement focused. And you kind of touch on a little bit of everything, but I know I have a lot of research and methods to share with us today. So it is my pleasure to introduce our distinguished speaker for today's seminar series, Dr. Tu Nguyen, who is an associate professor in the Department of Epi and Biostats at the University of Maryland School of Public Health. Tu and I used to work together at the University of California, San Francisco, and we overlapped in the Epi and Biostats department there. And so we started working on some social media research a while ago, and she has taken it to like a whole nother level. So I'm very excited to hear what she's been up to in the recent years. She is a principal investigator on some NIH awards where she's using big data. And what I love about Tu's work is she's really using big data like Twitter data, social media data, other types of data to answer equity and population health questions. And so I'm assuming that's what she's going to talk to us about today. But please take it away, Tu. And she said you can write questions in the chat, and she'll have plenty of time at the end for your live questions. So please do think of questions as she goes through her remarks. Thank you so much for joining us.
Thanks, Courtney. Thank you for the welcome, and it's so great to see you again. And I see Jen. Hi, Jen. We overlapped in grad school. And so thank you for coming to the talk today. Um, hi, everybody. So today I'll be presenting like several different applied studies using social media and machine learning qualitative methods to look at racism and bias and their implications for health and other outcomes. So then this is an outline of my presentation. I'll go kind of, did I stop sharing? Oh,
Now
oh,
you did, yeah.
okay. I will start sharing again. Why?
No worries, no.
Okay. So I'll be going through four examples. The first one is looking at the relationship between negative racial sentiment and birth outcomes from 2011 to 2021. That's a quantitative study. The second study is a qualitative study looking at experiences of racism and birthing from the perspective of Asian Pacific Islander, Black, Latina, and Middle Eastern women. The third study is looking at negative racial sentiment for post-referencing Asians, and then hate crimes against Asians in New York City. And then the last one's looking at immigration discourse on social media, on Facebook and Blue Sky and Twitter in the last decade. So those quickly read through several examples. So then for the first example, advancing slide. Okay. Um, Broadly, this research is trying to tap or capture cultural racism, which is the infusion of ideology of inferiority in the various language, imagery, and as unstated assumptions of society. We can see this expressed in many different ways. For example, it can be expressed in the media or through norms in society. And this is important because it forms the context that supports all other forms of discrimination, including structural, institutional, and personally mediated, which leads to the maintenance and reinforcement of health disparities, health inequities. Traditionally and most commonly, racism is measured at the individual level, often relying on self-report. But self-reports have a number of challenges, including ambiguity for people reporting it. Sometimes people might have challenges in recognizing reporting discrimination, coping mechanisms such as wanting to deny or not disrupt social relationships, or if the experience happened a long time ago, might be difficult to remember some details. In addition, some already marginalized identities tend to underreport. For example, people with lower SES, women, and in addition, certain groups, like immigrants or newly arrived, might have challenges are important because US-based racism might differ from other types of racism. So those are all challenges with relying on self-report. For social media, we can think of it as unstructured data that's rich and expresses a range of different opinions and beliefs, and then we can use it to help us understand the social context using a variety of different methods, such as qualitative, machine learning, and traditional epi methods. So often I get the question like, why use Twitter data or other social media to say racial attitudes and sentiment? There are a number of different reasons. Millions of posts are, of course, posted on Twitter as well as other social media platforms. Platforms such as Twitter, the majority of those make their user profile public, and it's a way to share updates and information. And rather than looking at like single posts or like a single expressions, our research group uses it as a collection to understand kind of changes in norms and attitudes and beliefs over time and place. So for study one, we looked at Twitter and collected tweets from 2011 to 2021. We collected English language tweets that use one or more race-related keywords. In total, there were over 55 million tweets. We use support vector machine to analyze the sentiment of the tweet. And it's a supervised machine learning model, which means it needs training data to understand what a person considers a negative or positive sentiment post.
Mhm.
So we use training data from our own research group as well as other research groups, and then we evaluate the model's performance. The final model has good accuracy for negative and positive sentiment classification, comparing the models labels to human people labels. So after we train the model and validate its performance, then we used it to label all of the Twitter data, and then we merged it with the birth outcomes data. So for each year, state level sentiment towards different racial ethnic groups were merged with the birth outcomes for that year. We adjusted for individual covariates, which were maternal age, race, ethnicity, marital status, and prenatal care initiation first trimester. And then we also adjusted for state level demographic characteristics. And then these were proportion of Latinx individuals, population density, other measures of social disadvantage. And then we estimated incidence rate ratios using log binomial models, controlling for both individual and state level demographics. So here are some descriptive statistics or descriptive results. So this is just a plot of the sentiment of posts referencing different racial ethnic groups over time, and we see the highest highest proportion of posts referencing a certain group that's negative are Middle Eastern, um, and then Black, and then over time we see fluctuations that correspond to different events that are salient for different groups. So, for example, during the national discussions about the border wall and the government shutdown, there's a spike in negative Latinx sentiment. And during the BLM protests, there was a decline in negative Black sentiment. During this during the Atlanta like when the Atlanta splash shootings happened, there was an increase in negative Asian sentiment. So certain events are associated with different spikes across time for certain groups of posts. And then overall, this is geographically proportion of tweets referencing racial ethnic minorities that's negative. Across the different states, we see higher concentration of negative sentiment posts in the South and Northeast. And then over time, it's gone more negative for most of the states. And when we looked at modeling results, we saw pretty consistent results where mothers residing in states in the highest negative tertile of negative sentiment, referencing racial ethnic minorities, have increased risk for low birth weight and preterm birth compared to mothers living in the lowest tertile. About 8% increase in risk of low birth weight and about 5% for preterm birth. And if we look at the estimates for the total population of mothers or racial ethnic minority mothers or white mothers, the estimates are pretty consistent across time. I mean, across the different groups, indicating that negative racial sentiment, referencing racial ethnic minorities, is associated with worse birth outcomes for the population as a whole. And then stratifying by racial ethnic groups and different categories of the sentiment. So, for example, negative Black sentiment and birth outcomes among Black mothers, we see an elevation of risk. Um, but and then some elevation of risk for negative Latinx sentiment and birth outcomes among Latina mothers, but mainly no results for negative white sentiment among white mothers and negative Asian sentiment among Asian mothers. And so in summary, negative sentiment for post-vaccine minorities is associated with adverse birth outcomes for the total population as well as racial ethnic minority mothers and white mothers. Interestingly, negative sentiment for post-vaccine white people were not associated with birth outcomes for white mothers. For stratified results, the most consistent and the largest effects were observed for Black mothers and less consistent for Latinx sentiment and Asian sentiment and birth outcomes for among Latina and Asian mothers. So overall, we know that racism is an organized system that influences the distribution of resources and risks and opportunities in a society. For this result, expressions of negativity might be demonstrating this ranking, right, ideology of inferiority, and this might be especially important for racial ethnic minorities, but also other groups as well. And cultural racism is born because it reinforces and it other forms of racism. Here, we find kind of negative associations for the population as a whole, and prior research has also had similar findings. For example, opposition for policies and programs has occurred due to racial animus for programs and policies that could benefit a large proportion of white people. For example, the Affordable Care Act. And it, exemplifying the statement of the former president of American Public Health Association, racism saps the strength of civil society. So it's kind of neat and important to look at racism impacts on both disadvantaged and advantaged groups. So this study has important strengths and limitations. The post represents what people are willing to express. And social media platforms in this one, Twitter, are not representative of the US population. They tend to be more educated and younger compared to the US general population. Here we're looking at sentiment of a post, which is the emotional tone of a post, which is different from expressions of prejudice. So these measures are kind of broad and blunt measure. They might signal kind of a negativity or like a broad signal for the social context. We have found that these measures of racial sentiment were associated with measures of explicit and implicit racial bias from Project Implicit. And then we're conducting future work examining both text and imagery. So using both the text and image of a post to categorize sentiment. And we're also developing models to look at hate and anti-hate specifically. So more developed models are in progress. So in the second study, it's a qualitative study looking at experiences of racism and during pregnancy and birthing. A lot of the prior research has been quantitative, and a lot of studies have looked at single racial ethnic groups in isolation. This study helps to kind of fill that gap. We conducted 11 90-minute focus groups with Asian American, Pacific Islander, Black, Latina, and Middle Eastern women from the North, South, and Western United States. And we wanted to explore the influence of racism during this time and gain understanding of policies and programs that could support women during pregnancy and birthing. So for the eligibility, participants were eligible to participate if they were 18 years old, use social media, have children, or were open to having children in the future, and self-identified as Black, Latina, Middle Eastern, Asian, or Pacific Islander. They also had to be available for a 90-minute focus group via Zoom, and all participants received a $50 gift card. We conducted the focus groups by race ethnicity. and most of them were conducted in English. Two were conducted in Spanish and Vietnamese. And then at the end, we collected basic social demographic information as well as content information. Oh. So this is an example of the flyer that we use to recruit different participants. So each flyer, there are different flyers created for each group. So this is an example of Vietnamese specific flyer. So we reached out and did advertisements on social media as well as reached out to organizations, and they sent letters to their members. And some of the questions we asked were, do you think racism and discrimination impacts pregnancy and birthing experiences? Why or why not? Are there kinds of policies and programs that you think could help protect people from the impact of racism during pregnancy and birthing? And what steps have you taken to protect yourself or somebody else from racism? So for our methods, the the transcripts were audio recorded and later transcribed, and then they were translated in English if the focus group were done in another language, and then we removed all identifiers. We then developed an initial code book based on the focus group guide and then the study objectives. And then we further refined the code book through consensus building meetings to ensure that the code book was accurate and in kind of helping us code. We use NVivo as a qualitative data analysis software to code all the transcripts. And then we met as a team during to resolve any disagreements by consensus. After the coding was completed, coding reports were compiled based on different racial ethnic groups. So one report for AAPI, the Black, Latino, Middle Eastern participants, and then we analyzed the coding reports to establish themes and sub-themes and connections both within focus groups as well as across them. So for the results, we found that there was a consistent reporting of kind of unequal power dynamics between patients and providers that influence how people like acted and their in their interactions with their providers. Black participants discuss some of their prior negative experiences and how this influenced their current kind of interactions with the healthcare setting. Latino women expressed fears of being treated differently because of their immigration status. And both Black and Latino participants shared that there was a constant racism-related stress for themselves and their children. Middle Eastern women remarked that one pivotal event was like the Muslim ban, and then after that, it seemed to bolster kind of stereotypes. Um, and Vietnamese participants shared how the effect of racism could impact mothers' mental health that then go on to impact their children. So here are some quotes from different women. So the first quote talks about kind of the unequal power dynamics and how that can shape interactions. The first person who asked me about my baby's name literally had a wand in in my vagina during the sonogram. The doctor asked, "What are you thinking of naming your child?" And when I said David, oh, a good, nice, normal name. So it catches me off guard sometimes because I wasn't expecting it to happen or to come up again in these spaces. I'm not going to check you and say you shouldn't have said that's a nice normal name because I don't know what you're going to do next. And I know that Serena Williams can't even get appropriate care. So I know if I ruffle feathers too much here, am I going to get appropriate care for me and my child during this time? So that was that. I see what's going on. Let me pull back and make you comfortable because I'm vulnerable to you right now. So another person talks about kind of interactions and fearing differential treatment. They said, will they judge me when I go to the doctor? The receptionist is going to look at me with a bad face. They will understand me when I go to get the medicines. All that has an effect. And so something that at least I would feel that worries me a lot. Another participant kind of remarked how they saw differences in treatment based on who they were with. So my daughter's father is white, and so a difference in treatment by staff just in the world, I think, when I was with him versus when I was not. In spaces where you totally be ignored, you realize that there's a difference. Oh, they're acknowledging me now, they're speaking to me now. I'm actually here and they see me and they're treating me with a little bit more visibility than otherwise. Um, Another, like, in addition to kind of who you're with, and then your race, another person kind of noted differences based on skin color. I want to say that my prenatal care experience being a brown woman and trying to utilize General Hospital, I just felt like I wasn't treated with a lot of respect and values. Just often I wasn't receiving the support I needed. So then in the later half of the discussion, we talked about potential solutions or um, things that would make a difference. And one participant stated that reputation matters, but it needs to start kind of way early. Hospitals and healthcare facilities need to recruit folks, even from high school, like Black and Brown people, to get into the healthcare industry. But then a participant also noted that while representation was important, it wasn't going to solve all solutions. And then she shared that, respectfully, I'm not referring to you all, but in general, we look at band-aid solutions to this really big problem. I think doula programs are great. Having staffers or interpreters that are there can understand culturally, linguistically as well the patient. I work in a school district and we have a lot of ABAR trainings that call anti-racist, anti-blackness workshops in order to promote inclusion and diversity and all that great things like that. Even with that, I also think it's a binding solution, but can also be helpful for healthcare workers to try and understand and listen. You know what I mean? I think each healthcare institution can have a panel, can listen to the community and kind of see where they are demographically, and understand that these are people, even if they're low income, even if they might not understand you, they're people, they be like you, and these are their needs, and this is where they come from. Um, yes. So then, overall, participants across the different groups express the value of racial diversity in healthcare providers and pregnancy-related support, such as doulas, but also warn that racial concordance might not be enough to prevent racism, emphasize the need to go beyond binary solutions. So we found that women's discussions of pregnancy and birthing, they're common as well as unique experiences that varied by race, skin complexion, language, immigration status, and political context. So these kind of highlights that when we're talking about racial ethnic minority women, qualitative research can kind of look at like nuances and differences and help inform kind of racial equity practices that are not the same for all groups, of course. So kind of leveraging timely data sources for measuring sentiment as well as experiences of discrimination can kind of provide new opportunities to investigate the impact of bias on society and health, and kind of using mixed methods to more robustly examine kind of these questions and answers. So in the third example, we looked at negative sentiment for post-harvesting Asians and anti-Asian hate crimes in New York City. So this was done from 2019 to 2022. The hate crimes data comes from the New York Police Department, and it was at the police precinct level. We collected random sample tweets in New York State, including New York City, that used one or more Asian-related keywords. We used the same sentiment analysis model as before, and then we aggregated the sentiment at the monthly level and implemented negative binomial models to look at the association between sentiment and hate crimes. We also adjusted for unemployment rate and the emergence of the COVID-19 pandemic. So here are just like the counts of hate crimes over time. We saw a spike in around March 2022. That's when like the emergence of COVID-19 pandemic, and another spike in March 2021. So we found that overall, an increase in negative sentiment of post-harvesting Asians was associated with 24% increase in the number of hate crimes in the same month. And the association was attenuated slightly after adjustment for unemployment and the COVID-19 emergence. And then conversely, increases in positive sentiment was associated with a 12% decrease in anti-Asian hate crimes in the same month, but then became non-significant after adjustment. So some strengths and limitations of this study, and the study kind of highlights some potential implications of societal crises and how that might exacerbate prejudice or racism. And of course, this is not new in history. Some limitations that are important to note is that we use report hate crime, which is underreported in general, but also among Asian survivors, which are even more less likely to not report compared to non-Asian survivors. The model looked at hate crimes at different like right at the city level, but we could this future studies can look at even finer spatial variations. We also did the unit was month, but then based on data availability, but future studies can look at weekly or daily data. It'll be kind of valuable to see how differences in the unit of measure and geographical unit as well, and incorporating future and different demographic and socioeconomic variables might be valuable. So this is just a starting point, but I think more investigations would be important. And then our last study is looking at social media discussions related to refugees and immigrants from 2014 to 2024. So we know that in social media, people talk about a range of different things, including about immigration. And platforms like X, Facebook, and Blue Sky have narratives about refugees and immigrants, and these messages range from empathy to hostility, advocacy, and misinformation. So unlike traditional media like news media, social media allows individuals to shape narratives in real time. So these are important because these discussions contribute to the overall evolving narratives about refugees and immigrants, and they can amplify concerns about solidarity or hostility or anxiety and political polarization around this topic. A lot of prior research has looked at kind of single platform analyses and very short-term analyses. Um, but this is a highly dynamic area. Um, and so this study hopes to kind of address that by looking at across platform differences and trends and looking at a longer time scale over the last 10 years or so to understand how narratives can change over time and how they're similar or different across platforms. So we collected English language posts from Twitter, Facebook, and Blue Sky in the US that contain one or more keywords referencing refugees and immigrants. We use 129 keywords from prior studies and also government glossaries. We conducted a sentiment analysis model and we labeled posts for positive sentiment, negative sentiment, and neutral. And then we calculate the average sentiment for each keyword. We also calculate the neutrality ratio, which is the proportion of posts for each keyword that were neutral. And we looked at frequency engagement. So for the different platforms, they had different engagement characteristics and statistics available. So engagement was defined as a sum of engagement statistics available for each platform. And then we also collected frequency, and then we computed the median values for both frequency and engagement and kind of divided the keywords into different quadrants. So overperformers were keywords that were low frequency and high engagement. Underperformers were keywords that had high frequency but low engagement. Particularly high performers were like high, high. So high frequency, high engagement, and particularly low performers were low frequency and low engagement. So trying to understand the patterns of frequency and engagement. So here are some of our results. So we see that across the different platforms. So for Facebook and Twitter, kind of similar patterns where we saw an increasing proportion of posts referencing immigrants that are negative. This steadily increases from 2014 to 2018, 19, plateauing during those years, and then we see a decline. A more steady decline on Facebook than Twitter. And then overall, we see neutral sentiment being the most common, followed by negative sentiment, and then positive sentiment being the most rare. On Blue Sky, we see a different pattern, and Blue Sky emerged in 2023, and since then it has experienced exponential growth. So over time, we see a steady increase in proportion of posts referencing immigrants that are negative. So here we wanted to see, like over time, do we see spikes in sentiment and posts based on different events? And we do. So for let's see, Facebook is on the left and Twitter's on the right. So we see for the escalation of the Syrian refugee crisis, we saw a spike in both neutral and negative sentiment. Similarly with the institution of the U.S. travel ban, we also saw a spike in negative and neutral sentiment. And then similarly, a spike in both sentiments for the family separation policies. And the patterns were quite similar on Twitter as well as Facebook. looking at like the keywords and which keywords, sorry, that's just my dog barking in the back. The keyword patterns across the different platforms, we saw that enforcement as well as kind of exclusionary rhetoric were tended to be the most negative. For example, ban Muslim or border crisis or our country back were the most negative scored keywords. Um, Rape refugee and ban Muslim were most negative on Twitter and Blue Sky, respectively. Ban Islam was the most negative on Facebook, and these also tend to have low neutrality scores. In contrast, humanitarian terms such as refugee aid and Syrian refugee had high neutrality values. So here, kind of looking at the geographic distribution, kind of similar to the race-related posts and keywords, tend to have kind of higher concentration of negativity in the south and northeast, but some scattering. And then overall, more negative sentiment posts for immigrant broadly related posts versus refugee specific posts that tend to be more neutral. And here we look at kind of frequency engagement patterns across different platforms. Here I'm showing a comparison between Twitter and Facebook. There were some similarities and differences. On Twitter, we saw that overperformers that have high engagement but low frequencies, these were the Migrant Protection Program, Work Permit, Title 42. Underperformers are keywords that have high frequency and low engagements. And these were keywords such as illegal, border control, and go backward. And then for terms that have high frequency and high engagements, these were migrant caravan, travel ban, and ICE. So looking at Facebook, we saw that migrant caravan and travel ban also appeared in high frequency, high engagement quadrant for both Facebook and Twitter. However, Title 42 was an overperform on Twitter, but underperformed on Facebook. And Title 42 was a policy that says that, during times of kind of pandemics or health crises, the CDC can um, uh, like make it stricter for people to immigrate. Um, and then by contrast, Brave Refugee had low engagement on Twitter and emerged as an overperformer on Facebook. And then for no refugee ban, that was consistently low frequency and low engagement. So we saw patterns that were different and similar across the different platforms. So for this study, we looked at temporal and geographic trends in social media discussions across a longer time scale and across different platforms. However, the study is exploratory and descriptive. These expressions are of sentiment, which is different from prejudice. And of course, these posts represent what people are willing to express. So in conclusion, kind of the social environment is an important context to study, and especially social media data has it's a rich data source that can reflect attitudes and norms, beliefs, and this can impact behaviors as well as important outcomes. I'd like to thank my Big Data for Health Equity Research Collaborative, my funding, and then just a plug for my upcoming book, From Posts to Patterns Using Social Media to Investigate Drivers of Population Health. It'll be published by Wiley in 2026 in July. And those are all my examples. Sorry for running through them all. But I'm open to questions and then happy to have a discussion.
So amazing. So many different examples.
So many.
I love it. I'm going to give a space and see if anyone wants to write anything in the chat or raise their hand. But I can get us started because we have plenty of time today, and I think it's actually a really rich thing that we can different studies actually have different angles too that we could get into. So I'm going to kick us off, and then please do start writing in your questions or raising your hands because we have plenty of opportunity for you all to engage. I had first had like a logistical question, then I have a more bigger picture question. When you are getting these content down from Facebook and X and others, can you talk more about like the scraping process or the storage like what if everybody else wanted to get into this? I know Twitter had some publicly available data set, like talk through how do you get access to this data? What does it really look like in case other people are interested in thinking about a social media research question?
Yes, that's
Yeah.
an important question to ask. And then this changes over time too. Like you mentioned, right? Twitter had like this public API. They had two APIs, one for the public for anybody to use that was free, and then another academic track API that researchers, universities can apply for that allows for historical data collection. So then the public API, you can collect like 7 days, like present and future, but the academic track allow historical queries. But anyways, they took that down. So then we're like, no. But we kind of knew that was gonna be taken down. So we tried to collect as much as data before it was taken down. So then like now we kind of store and try to do analyses with it. And then our immigrant refugee paper, we had collected some of that post before it was taken down. So that's how we got that data. But then for Facebook, right? That changed too. So before it was called CrowdTangle, where it was also open to the public. It was free. I think you had to apply, but it wasn't that hard. But then they're like, we will now discontinue. Sorry. And but then like unlike Twitter, they like we are now migrating to a different dashboard that you have to apply. So we applied for that and it took a while, but then we got approval. And then we can still collect data from Facebook and Instagram using that mechanism. So that's how we did it for Facebook. But now we just have to like learn new applications and new mechanisms. But at least it's open to researchers for Facebook and Instagram. And then for Blue Sky, it's still open. They have a public API that people can use for free. So Facebook, Instagram, Blue Sky, it's not a problem. I think Reddit, I think there are scrapers available. And then I think there's also okay. There's there's also scrapers, but then there's also push shift and like other applications that allow historical data collection. But we're getting Reddit data through collaborations with people who've been collecting Reddit data for a long time. But then that didn't make it to this paper. But yes, I think each platform has their differences in what they allow for access. But there's still some platforms that you can still collect for free. Now Twitter you can still collect, but it's not for free anymore. It's very expensive.
That's what I was
But
wondering. So
yeah,
after they
but
changed
there's
it, now
still
it's
it's
pay to
still
play on
viable
some of these.
for
Yeah.
for research.
I'm going to summarize that into maybe ask social media researchers first before you dip your toe into just because it depends on what year you're interested in. If you're interested in a longitudinal study or a cross-sectional study, and if you're interested in different platforms, like there's actually a lot of different. I mean, I guess that's like any publicly like survey data, and you have to know somebody who has some knowledge about the platforms because it can seem overwhelming, but there are options for many of the different platforms, I think is how I'm going to summarize
Yeah.
your amazing answer. Yeah.
Yes, and you don't need to reinvent the wheel. People have a maybe like, yes, you apply to this application here. Or they be like, remember the policies, or like other people might have collected the data that you need already. So it's
Yeah.
good to just reach out. Yeah.
Yeah. Reach out and make connections because it's novel data, but you can, I mean, even then you almost have it's almost getting up to 20 years, at least 15 years and getting into 20 years for some of these platforms. So there are data available in different ways than many people expect. Okay, I have a content question, but I'm going to go to Patrick. Patrick, what is your question?
All right. Hi, I'm Patrick Romano. And two quick questions or thoughts. Obviously you went through the slides very quickly, so I might have missed something or misinterpreted something. But first, in the first paper, I was surprised, maybe I shouldn't be, but I was surprised and disappointed by the consistently high negativity
Mm,
of the posts related to Black Americans.
mm,
And it appeared to be uh, almost invulnerable to changes in the environment. I think it was around the 40% range or so forth throughout the time period that you evaluated. That was a bit upsetting. I mean, we sort of anticipate that there are cycles related to Middle Eastern Americans that may be influenced by current events, but it appeared that the Black American sentiment was not. So that's one question. My second question is on the third paper about Blue Sky. Blue Sky has this reputation of being the more, progressive um, social media outlet that favors people who have a more inclusive view of the world. And so I was disappointed, perhaps, to find that you had found some of the same negativity on Blue Sky that you found elsewhere. So, thoughts about those two observations?
Yes. Oh, yes. Good observations. Okay. So then for Black one, there is like it did kind of momentarily inc like for during like let me go back to the the chart the where did it go? It was a chart where
The line
showing.
graph, right? Yeah, it's a little
Yes,
earlier. There it is.
yes.
Here.
So
11.
here it is true. It's just like you just see like a steady increasing. There was a temporary dip in the BLM protest in like the summer of June, of June, July, May, um, 2020 with the killings of Ahmaud Arbery, Breonna Taylor, and George Floyd. We saw a momentary dip in that, but then it got back up. But yes. It's kind of it is sad how it keeps goes up and momentary fluctuations. Oh, and then but we did see, but at least for the BLM protest, and then we did a mixed methods paper for that specifically, looking at both the sentiment patterns as well as the themes expressed there, and then your second question was, what was your second?
Blue sky.
Blue sky. Yes, it is. It does tend to be, right. They have a reputation for being more progressive, but we see over time that I think it is potentially still less negative, right? 30 something percent. Well, that's true. Here's a in the quarter of 2024 at the end. Oh, and we don't have 2024 here. I think we have it for Facebook, but we want it to be the similar. I wonder how it would be in 2024 for Facebook and Twitter. But by 2023, it was 18% and 16% negative. Oh, you're right. So it's very comparable to Blue Sky. Hmm. That's also interesting, right? But then this is just sentiment. But looking at like, which is a broad blunt instrument, if we look at kind of sometimes negativity could be like, oh, I like racism, or it could be like, I hate race. It could be expressions of anger that could be against racial injustice that would also be categorized as negative. So it's like it could mix both
Yeah,
types.
I mean, I guess what I'm getting at is maybe the negative sentiment that you're capturing on Blue Sky is a different kind of negative sentiment
Mhm.
about how
Mhm.
laws are being enforced or about
Yes.
how the government is responding. I don't know, but I'd really like to kind of get behind those numbers to see,
Mhm.
are there subtle differences that are important, you know,
Yes.
that maybe, I could be totally wrong, but maybe the negative sentiment on Blue Sky is less overtly racist, uh,
Mhm.
but maybe it's still racist. I don't know.
Yes, no, it would be good to analyze for that paper. We recently got a accept for publication. I think it came out, but we just did a quantitative analysis. I think it'll be valuable to do qualitative like content analysis on that as well.
Okay. Thank you.
That was
Thank
actually going to be
you.
my follow-up question. It sounds like you have done some mixed methods with the BLM, time point, and others. Are there anything about some of your other studies that looks into the specific you have keywords that come up here, but anything else from that work too that would be interesting? Because I am curious about that. There's like a sentiment, a broad and blunt look, and then there's like both both in positive and negative words, like real examples of how people are carrying forward words. Do you find anything different when you do the mixed methods types of analyses that, I mean, obviously you do because it's a mixed methods now, but like, could you give an example of something that triangulated or rounded out some of these quantitative findings from when you go a little deeper in the content that you pull down to give people a flavor of that? I think that would be interesting. Is there anyone that comes to your mind?
Yes. Well, we did a paper on like the killings of George Floyd, Ahmaud. Ahmaud Arbery and Breonna Taylor. And then we saw like, a decline in the black sentiment, but that only lasted for a few weeks and then like a resurgence. But then in the themes, we saw like we did it before and after the killings to see how discussions changed. And then before there was like hardly any discussions on like on like racism. But then after that there was like more nuanced themes like recognition of like a history of racism or like now more people who are disadvantaged like understanding and learning more and recognizing and then there are like calls for action like we saw calls for action for participating in protests and voting and other things. And then so even though like the quantitative kind of show like a depressing image of a short-term trend, the qualitative kind of looked at more like what were people feeling and how they were wanting more lasting change. And then of course when we did the policy analysis, like over time, many different states changed their policies and funding and differences in like what police can and can't do. So I think that was like a neat paper because it looked at different angles. We looked at Google Trends as well as social media posts and equality and quantity. And that paper has been published. So that was kind of a neat look at like one sad,
Yeah.
very sad.
Yeah, and it's so interesting to think about that moment in time and think about our moment in time now and what the social
Yes,
media research will look like. So thinking there's so much happening at once on social media, it seems in this current moment, blending a lot of these different like that was sort of my content question, which maybe you could expound upon, and then others. There's still about 12 more minutes if other people have questions for Dr. Wen, which is I was curious about. You have a lot of historical data, and then it's almost as though a lot has changed in the last year,
mhm,
in
mhm,
particular, both
mhm.
online, but also in anti-racism research in general, and sort of how we're thinking about it. I was wondering if you could reflect on what this past year has
Yes.
looked like and sort of what you think you're going to bring into your portfolio of studies.
Yes. Oh, that's a very also
It's a big question.
big question and one that I'm still grappling with because I think other people have experienced this too. This year has been very hard. Like this past year, and we saw like health disparities research has always been underfunded, but then for the last few years, before last year, it was like, oh, now we're recognized. We're actually like a recognized field. And then there was like more funding and like more recognition, and then boom, it was like, nah, squish it all. And now like it's it's hostile. It's like the funding is very hostile towards it. And then but yes. So it's been a bad year. But for we had well the one of the grants I was on was terminated,
Mm,
but then it was like reinstated, but then another grant like it's been oh
been
like
crazy.
it's
Yeah.
a crazy year. But then like I guess for publishing, we haven't experienced too much in like pushback and like what we can or can't say. So at least that's like a shining thing.
Yeah, that's what I
Like,
wanted you to reflect. Yeah, and
yeah,
you've still been publishing. I mean, you haven't changed the name of your lab or the name of your studies or even the terms that you're using to describe. I mean, your research is about
yeah.
anti, racism sentiment overall, and then some sort of racism specific sentiment. And I just wanted everyone in this room to hear that despite a tumultuous year, you're still publishing and
I
you're
still
still moving forward. Yeah, as a bright light
yes.
maybe in this time.
Oh. And then like we recently turned in like a book manuscript. We've been working on this book for like a year and then this has happened and we're like, oh no, they're just gonna pull the plug. They're gonna be like, we're no longer interested in you or your research or whatever. But then like last week it was accepted for publication. So then the book is coming out like, oh okay, my goodness. Because I was
Great.
like, it's gonna fall, something's gonna happen. But I guess it's still I guess being accepted. But just the
Wonderful.
funding is terrible. Yes.
Yeah, that's thank you. I know that's the real answer, so I wanted everyone to feel comfortable asking questions like that of you. Kristen, I see you have your hands up. Do you want to ask a question?
Yeah, we hear about bot accounts on Twitter a lot. Were you able to
Mhm.
detect any bot activity with those with any of your research?
Yes. We have been for the last several months, we're like, oh, we should look at when we looked at the refugee and immigrant people, we're like, I wonder how many of those are bots. So then we have been trying to kind of create a way to kind of identify and look at bots and how they could influence the discussion. But it's actually more complicated. Why is things always more complicated than you initially think? So we're still tweaking the tools. But for like a simple analysis, sometimes we would, because we have the unique IDs for each post has like unique post ID as well as like a unique ID for the user. So sometimes we'll run analyses with like excluding posts that have like a X number of posts in the data set. So then we remove posts that are like high frequency posts. Those tend to be bots. And then we have parameters for like how frequently they post and then how like their following follower count. So sometimes we try to identify bots like crudely, but we haven't done a like specific paper looking at bots, but I think that would be important to do. It's something that we've been trying to do, but we haven't perfected it or even gotten to a level where we're comfortable. But we have we have put some efforts into the influence of bots in these discussions. But also another like thought is that even though bots make up some proportion of these posts, sometimes bots are quite sophisticated, and then it's still an exposure, right? The messaging is still out there in the universe, even if it's like a human or a bot. So studying exposure, it's those are still expressions. But yes, that's important activity and something that we're trying to do.
No, that's great. I might ask one final question, but please, if someone can squeak one in after me, if there's any final remarks. But I was curious about the geolocated
Mhm. Mhm.
data. Is there obviously is that still something that you can scrape down from these sites in terms of because I was wondering about bots and geolocation is sort of what came
Mhm.
up next for me. I know you have that lovely map across the United States, it's feature on all the platforms that you can share your location. I know Instagram just even turned it back on and made it sort of like the standard feature. But is there anything about the geolocation in
Mhm.
general that you wanted to talk about or about that in relationship to bots, given our previous question in terms of how you see patterns? Because I was wondering if that comes up in
Yeah.
your research. Hmm.
Yes, geolocation is very valuable because, of course, with geolocation, then we can merge it with other kind of like economic indicators or like other things like health outcomes, right? But link it by geography. And then of course, different platforms have different geographic identifiers. With Twitter, they used to have like a loc place like variable, and that will be either like self-reported, like you can type it in, or you could have like have your cell phone on and then they have the coordinates. So we had to clean that. So, but at least it's a variable that could be cleaned. With Facebook and Instagram on the dashboard, they have a series of variables. One is like for like the account and one is for the post. And then there's variables by country. So I think it's pretty easy to identify the country of the post. And some posts have both post level as well as account level geographic information. So yes, there is a way to do it, but you almost have to do a post processing. Like you collect the post and then you have to go back and be like, okay, let me find the variables that have uh, place information. And then so there's like a three or more variables that have that. And then you have to pick for your research study which one makes sense, the post level or like the account level. And then they have different geographic granularity. So it's like a long process of cleaning, but it is possible to get geolocation. I think it's worth it because it enables lots of different types of studies and merging.
Oh, well, I can't wait when you've published your bot methods and then you disaggregate it by location because I think there's a lot of thoughts that bots originate outside the US, but I'm curious. I bet there's a lot originating inside the US. So I'm very curious about what that will look like once we know more and how important it will be with all the AI generated and other types of content that bots have been that are like the tip of the iceberg right now that it's like broken loose in the last year or so. So many cool questions.
Yes.
I think,
And then for Reddit and Blue Sky, I think it's hard to get geographic location. I don't think they have it easily. So I think you can get it from Twitter. You can get some information by Facebook and Instagram, but Reddit and Blue Sky, there isn't like a like easy avenue to get location information on those platforms.
yeah. I'm thinking of all sorts of questions in the last year that I want to answer with social media data. Your talk has like opened up some of the things that might be interested. I hope some of you might be interested. It's messy real world data, but I think a lot of our data moving forward is going to be this real world data and how do we grapple with it? How do we think about it? How do we, make sense of it? And you have spent a lot of years really making some pathways forward for us. So I just really appreciate that. I think I know if people wanted to contact you, I think you would be willing to get emails or other things from them. So for people to reach out if they are thinking about some of these data sets. Yeah, but I just think this area of research and it's like this blend of news and real world news plus fake news plus real sentiment. It's the future of where we're headed, and we have to grapple with all these methodological considerations when we think about using social media data. So I wonder if you have any final words for us as we think about our research or what we can do in the future, but really just wanted to thank you for your time too.
Thanks, Courtney. Thank you for asking all those terrific questions, and thank you for yes, like saying that this is valuable research. I think it was so often that sometimes it's like really nice to hear because sometimes people be like, this is just entertainment news, or like that's not really research, or like what you do. So it is nice to recognize that it's actual research and it could have important implications. And I do think it's messy. And then sometimes people, like even I feel disheartened about the current state of things, but it's so important to study and help disparities is so important to try to make headway. And yeah, I'll still be here, hopefully, doing this kind of research. Um, yeah.
Yeah, that's amazing. So please do reach out to me or to Two if you have questions that we can get you unstuck. But just really appreciate you coming and joining us. I appreciate everyone joining live today and on the recording. And I think we'll just end a couple minutes early to get you onto your next thing. But I wish you all the best for 2026 and have a great day, everyone.
Thanks, everybody. And I put my email in the chat so folks can contact me.
Perfect. Thank you so much, everyone.
Thanks, everybody.
Bye. Thanks, Two.
Okay. Thanks, Courtney.
Bye. See you soon.